The main messages are the following. First, no change on prevention, only patient with the highest risk with the highest risk procedure. Second, change in the diagnostic procedure will focus on other imaging techniques than echocardiography, more and more frequently useful. Third, major new concept is the concept of endocarditis TEAM. And finally, surgery will be necessary in half of these patients, and we do not need to delay surgery in these patients.
The important step is to distinguish between primary and secondary MR. Primary MR, no question, requires timely surgery, not too early, but early enough to avoid any irreversible damage. In secondary MR, this is a late consideration, it's a palliative procedure, but it will be in the future one of the major heart failure therapies we have in this patient group.
3D printing is entering the area of valvular imaging and repair, as illustrated by the first 3D printed tricuspid using transthoracic echocardiography.
We hope that it will facilitate the communication with the surgeons, with relatives, and it also will hopefully provide us with more insights on the tricuspid valve pathologies. And the hope is that after advancing our understanding, we'll also be able to project much easier the future percutaneous intervention dedicated for a tricuspid valve that now are emerging in the field.
I think the new guidelines give us the precise treatment for acute pericarditis, for recurrent pericarditis, for pericardial effusion, for tamponade, for constitutive pericarditis, the precise indication when to go back to exercise for normal people, for athletes, for people who have perimyocarditis, that's to say pericarditis with myocarditis, how to treat pregnant women, how to treat children, and how to treat all the spectrum of the disease of the pericard in the field.